Hello, my name's Dean Elliott. Some of you may know me. I've got many friends and colleagues that have been in touch recently, and I thought I'd put together a bit of a video log, vlog, blog, whatever it is, purely just to get my story out of myself. I thought I'd do some personal reflection. I'll use this to communicate to many people that are genuinely interested, which I appreciate. I've got a lot of family, close family, and also family and friends around the country and other parts of the world who are sending me messages of support. And possibly people may just come across this out of interest, and if it helps other people, then again, there's only good that can come from this. So I thought I'd give you a little bit of a potted history of myself, what's happened. I'm 56. I retired from the fire service 2 years ago, 2.5 years ago now, after doing 32 years service. And in May last year, I started to get symptoms, restless legs, people could call it. I was very fidgety, which is not uncommon from myself. As people know, I'm a little bit of a fidget bum, and I go out and about, and I'm always doing something, can't sit down for very long. But I was finding my legs were getting very sort of making me wanting to sit up after a period of time and wanting to walk around. But then I got this feeling, what I could only describe as somebody that's just run a marathon or done a lot of sport, that lactic acid feeling in my legs. My legs felt very heavy in the mornings. I'd get up out of bed and I'd find that it'll take me half an hour for the legs to warm up and get movement because they were quite stiff. But it got progressively worse over the summer, to the extent where it was in my shoulders and then started to feel it in my hands, my knuckles. And some family members found it quite entertaining. I couldn't even get out of the car without being in pain. So there was a few comments saying, you really need to get this looked at. So I did. I got referred to see a specialist. After going through my GP, I got referred to a rheumatoid specialist in High Wycombe, and that was in October. And quite quickly he diagnosed me with something called polymyalgia rheumatica. Now that is an inflammation of the joints. It's quite common in people of my age. The older you are, it's more common, less common in younger people. But it's basically affected all of the joints, become a little bit stiff, and there's no reason why this happens, but there is a number of different treatments that you can have, and one of those would be to take a course of steroids. I was reluctant to do that, but on advice, he said that this is the quickest way of dealing with it. It acts as like a mask of the pain. Within a few days, you won't have the joint pain, but you have to take the steroids daily. And the idea would be that you would come off of the dose slowly, and hopefully the polymyalgia would pass through your body. Now this could take up to 2 years. So I started on a course of steroids in October, and within 3 or 4 days, all the pain had gone. In fact, I have got what I call a bad knee, a detached cruciate ligament, and there was no pain with that. And I used to have a lot of pain with my knee, especially when it was damp or it was cold. So I thought, oh, this is great. Wasn't necessarily happy to keep taking steroids, and the idea would be to reduce the dose. And I found that after 24 hours, even no matter what the dose was, I could feel it wearing off. But I did start to get a sore throat. Around about a month afterwards, I kept saying, I've got a bit of a cough, a bit of a sore throat. Thought it was just a reaction to the steroids, but it didn't go away. And then I started to feel like there's something in my throat. I would describe it as a golf ball, but probably not as big as that, sort of like a marble in the back of my throat, that swallowing feeling. I could feel something at the back of my throat. So I got to around about December, went back to my GP, gave the GP my symptoms. She was very good. She felt on my glands. I could feel a slight swelling in my glands up here on one side. And she said that best thing to do was to get it looked at through a hospital appointment. She did say, look, the way this is managed, you will get a letter, you'll get an invite to go and see somebody at ear, nose and throat specialist at the hospital. Don't be too concerned if it mentions the word cancer, but that's the process that you have to follow. No problem. And I went to see somebody between Christmas and New Year at Stoke Mandeville Hospital. They had a look inside, they had a feel around, and they said they couldn't see anything, but with my symptoms, again, they would put me through for what they call an emergency MRI scan, I think again because of the timelines. So that scan was on the 6th of January 2024, and I had a follow-up appointment booked for a month later, around about February the 9th. But within 2 weeks I got a call from somebody from the department just saying, could you come in? We've got an appointment, could you come in earlier? And I said, yeah, no problem. Alarm bells weren't even ringing. It was, yeah, okay, no problem, I'll come in, thinking they might just have a space. So me and my wife Tanya went to Amersham Hospital to see the specialist to get the results. Again, sat there thinking, yeah, they're going to say maybe it's a reaction to the steroids, maybe some alternative treatment. Walked in the room, there was the specialist in his suit, 2 or 3 nurses, the person I'd seen in Stoke Mandeville who gave me the original oral examination, and a computer screen with the scan, lots of white patches and dark patches, and I looked around going, I didn't expect this. Then sat down, and then they basically turned around and said, look, you've got a tumour here, it looks like it's possibly a cancerous and malignant tumour, we do need to do some more checks. Again, took the news as it was, but the specialist said, look, this is something that is quite, whilst it's not common, it's something that they deal with a lot. Mentioned a few people, famous people that had things like this, someone like Michael Douglas, but they wanted to do a biopsy. So following that, I went to have a biopsy at John Radcliffe, where he actually put a needle into my neck and took some samples. Also had a thing called a PET scan, which is where they inject a radioactive liquid into your bloodstream, and then they scan your whole body to see whether there's any other traces. And went to see a specialist at the Churchill Hospital, which is in Oxford, and sat there and went through the whole diagnosis, which was that it was a cancerous tumour, malignant. It's something that's linked to what's known as a HPV virus. It's very common from the point of view that if it does become a problem for women, that HPV virus can turn into cervical cancer, and in men, for some reason, it does attack the throat. So the positives from that was, he said that it's treatable, it's curable, if you treat it early. They believed it was around about 30 millimetres, 3 centimetres, and it was just in my tonsil area. Even though I had my tonsils out when I was 4, it's in that area. But it would mean some radiotherapy and a little bit of chemotherapy. We did ask the question about whether or not it was a cancer that could be cut out. He was reluctant to go down that route to start with because of the impact of cutting into the skin, possibly taking part of my tongue away, and reconstructive surgery. But he said, statistically, this type of cancer, treat it with chemo and radiotherapy. Very, very high chance of it being destroyed with small side effects, but it's a 6-week program. So me and my wife had a discussion, said, yeah, this is something that we're going to have to go. It's very, very quick. NHS have worked amazing. We're now looking at, it's the 8th of March now, so within 2 months of having my very first scan on the 6th of January, I'm already geared up to have treatment, which starts on Monday, the 11th. In that time, I have done a lot of research. I've spoken to a lot of people. I've spoken to people that have had the cancer and had treatment, and I'm thankful for that. Been given a lot of advice from those people that have been through it. I've also watched a documentary from the comedian Rod Gilbert, which is on Channel 4. He calls it A Pain in the Neck. Very, very similar type of cancer that he had. His was in the lymph node as well, but he had the same treatment as me. Bit of an eye-opener, but at least I know what I'm going to be going through. So that's where I am at the moment. I've had numerous tests, numerous checks, checked on my teeth, x-rays to see whether there's going to be impacted. I've also had a mask made where they put a plastic mesh over you and it moulds around you. I'll see if I can put a photograph up. But I start treatment on Monday. I've slowly started to tell people I'm positive. I've always been a positive person. I will deal with it. That's the way I deal with it, head on. I know that I will be going through a little bit of a roller coaster, as they say. There are some side effects when it comes to the radiotherapy treatment, radiation, and the chemotherapy. So the chemotherapy is an injection on Tuesday, and then 3 weeks later another injection, and that assists with the radiotherapy. Radiotherapy is more external and targets the tumour. After a few weeks, I'm likely to have a very, very sore throat because they're planning to do treatment both sides. What that means is I will struggle probably to eat, definitely, and I'll be struggling to swallow, whilst I've got to try and keep it moving and lubricated. So I've made a decision to have a PEG, a PEG feeding tube put in my stomach, so that's happening next week as well. That will help me get food inside me for the nutrition I require. So I expect after a couple of weeks I'm going to be feeling quite fatigued, probably sore around here, maybe some ulcers in my mouth. I really don't know, I'm just going by what other people have said. I will deal with it as best I can. I'll probably have ups and downs. I like to keep busy, so I might do a few of these. Just sort of give people an update. I really do appreciate the personal messages that are coming through, but I'm sure you can appreciate that there's a lot of people asking relevant questions and asking after my health, which I do understand and appreciate. But I like to be consistent, and I don't want to keep cutting and pasting, and you know, I will send messages as much as I can. I might not have the energy to do it, so my plan is I might just do a daily record, or so many days, I'm not saying every day, on this, post it. I'm not precious about whether or not it's shared. Like I said, if there are other people that want to know how someone else is going through it, I'm happy to share my experience. And that's what happened to me from the point of view that I got that information from others, and I was truly grateful for that, because it's allowed me to get things mind mapped of where I'm going. As far as work goes, I'm very fortunate. I retired from the fire service, so I've got a pension, but I do have other work that I do that's been put on hold. But I've got a support network around me of friends and colleagues and work friends that are helping me get through it. So hopefully, fingers crossed, touch wood, I'll come out the other side, hopefully by about May. But I will be under the supervision of the Churchill Hospital probably for 5 years. And a thumbs up to the person, I won't mention his name on here, but the person who I spoke to recently on Monday when I start my treatment is exactly 5 years to the day that he started his treatment, and he'll be 5 years clear. So congratulations, and I hope that I'll be in the same position in 5 years' time. Crikey, it'll be 61. And maybe a higher handicap at golf, because I don't think I'll be swinging much for the next few months. Anyway, that's me. I'm signing off. It's just me putting my mind out there and talking, because I won't be talking much probably in a few weeks' time when the pain kicks in. Please keep the messages going, and thanks a lot for your support.